Hi, welcome to my channel, Heart Disease Diaries. My name is Nicole. In today's video, I am really excited to share an article with you about the 5 medical breakthroughs for 2023. Before we get too far into 2024, I wanted to share this article with you because I think that it's very encouraging and hopeful. Even if you yourself do not have a chronic illness, or if these medical breakthroughs are not for your chronic condition, all of us know somebody who has been impacted by a chronic illness. And so learning about the medical breakthroughs and the advances in medicine, I think can be really encouraging and hopeful. So I'm really excited to share this with you, and I hope that it's okay. I'm just going to read the article to you, and I will put the article in the description box in case you want to reread it yourself. So let's get into it. All right, so it is called the top 5 medical breakthroughs of 2023. Okay, so number 1 is Pain School for Chronic Pain. Chronic pain affects approximately 37.8 million midlife and older Americans, and nearly a third have high impact pain that makes daily life difficult. In 2019, the Department of Veterans Affairs called the National Academies of Sciences, Engineering, and Medicine to study the potential of the whole healthcare model being used at the VA to address chronic pain. The Salem Veterans Affairs Care Systems VHCS Innovative Prevail Center for Chronic Pain gives veterans basic coping strategies through an online or face-to-face pain school, after which they meet for an hour with a caregiving team made up of a psychologist, a pharmacist, a dietitian, a physical therapist, and a physician specializing in pain. That creates a personalized 6-month treatment plan focused on healthy eating, exercise, spirituality, and reducing stress. Prevail's first group of 280 participants have reported that their pain is no longer controlling their life. So that is really cool, looking at this kind of holistic approach to treat pain. I think that's really cool, especially for our veterans. Number 2, new prostate cancer treatment for men. Ultrasound and other focal cancer therapies that treat part of the prostate are offering new hope to men with prostate cancer. TULSA-PRO is an outpatient procedure cleared by the FDA in 2019 that destroys cancerous tissue from inside the prostate gland with ultrasound heat. Doctors use magnetic resonance imaging to guide the robotic procedure, while a cooling catheter inserted in the rectum reduces heat exposure of nearby tissue. Recovery is generally faster than with surgery or radiation. It's intended mostly for men with low and intermediate risk prostate cancer that hasn't spread. In a recent study, where midlife and older men with low to intermediate risk prostate cancer who had their prostate gland completely treated via TULSA-PRO, 96% of participants saw their PSA levels fall by 75% or more within a year. 25% had new problems with erectile dysfunction, also known as ED, and 11% reported some urinary leakage or incontinence. By 3 years after their procedures, 13% needed additional prostate cancer treatment, but none had severe erectile problems, and 99% didn't need pads for managing incontinence. In contrast, 25% to 33% of men who undergo standard surgery or radiation treatment see their cancer return, according to the Cancer Prostate Foundation. This is really cool to see more research on prostate cancer, because I hear a lot about what they're doing when it comes to breast cancer, which obviously is a very important cause as well, but I really don't hear a lot about the advancement in prostate cancer, so this is awesome to hear. And actually, the third medical advancement has to do with breast cancer. Number 3 is better cancer screening for dense breasts. So I want to define what dense breasts are, because I actually didn't really know what they meant by that. So before I get into this one, I want to just define it very quickly. Your breast density reflects the amount of fibrous and glandular tissue in your breast compared to the amount of fatty tissue. So that is breast density defined. Now let's get into this medical breakthrough. Cancer risk is up to 4 times higher in dense breasts, possibly because dense tissue has more cells that can become abnormal. And women with dense breasts may have higher levels of estrogen, which can increase the risk of cancer. Conventional mammograms may miss up to 40 to 60% of cancers in dense breasts. A 3-dimensional whole breast ultrasound screening called SoftVu was recently granted pre-market approval by the FDA as an add-on cancer check for dense breasts. With this 3D whole breast ultrasound tomography system, the new technology sends sound waves to create a 360-degree image of the breast that offers a more comprehensive look at the tissue without compression or radiation, showing tissue changes in detail. That's cool that it doesn't use radiation or compression. Clinical data has shown that scans with SoftVu plus a conventional mammogram found 20% more cancers than mammograms alone, and were better at weeding out false positives. That is awesome. Number 4, advances in glucose monitors for people with diabetes. This year, Medicare expanded its coverage for glucose continuous monitors. That's wonderful because a lot of people that are 65 or above rely on Medicare as their health insurance, and sometimes there's a lot of gap in coverage. So this is awesome. Go Medicare! So Medicare expanded its coverage for glucose continuous monitors, making it significantly easier for millions of adults to manage their blood sugar levels. Once used mostly for insulin-dependent type 1 diabetes, CMGs are rising fastest among people with type 2 who typically take oral medications and may use injectable drugs, sometimes along with insulin to control their blood sugar. Compared to fingerstick blood sugar checks, CMG devices help midlife and older adults lower their blood sugar further and keep it in a healthy range longer. That is amazing. And then number 5, a new way to bust blood clots. Let's go bust those blood clots. I hate blood clots. Pulmonary embolisms, also known as PEs, are the 3rd leading cause of cardiovascular death in the United States, behind heart attack and stroke. I hate that. I hate hearing about death related to stroke. Hospitalizing 350,000 people per year and causing more than 100,000 deaths. The clots usually form in deep veins in the legs and travel upward to the lungs. Pulmonary embolisms need aggressive care to prevent heart and lung damage. Just a little pause here. When I was 7, after my first open heart surgery, I had a blood clot that started in my leg and it was going towards my heart. It circled back and settled in my groin, but this stuff is scary, so I'm going to continue. The Bashir endovascular catheter is a device that's threaded through the blood vessels to the lungs that opens into an expandable infusion basket in the clot, creating multiple channels to allow the blood flow, while the catheter's arms spray a clot-dissolving drug directly into the blood clot. The Bashir and the Bashir SB endovascular catheters, cleared by the FDA in 2023 for pulmonary embolisms, are part of a growing number of treatments for medium risk pulmonary embolisms, which affect up to 65% of people with the condition. I was really excited when I read about these 5 medical breakthroughs in 2023. I hope that you enjoyed hearing this information. I find it very hopeful. What medical advancement would you like to see in 2024? Drop me a comment below. Thanks so much for watching. Have a good day.